I mean, the microbiomata, basically it is having the connection probably to any subfertile patient. And if the endometriosis patient is having subfertility, in that patient it is relevant, but it is relevant to any subfertile patient actually. So what I'm trying to say is that there is a role of probiotics. So the general flora of the vagina um, has a role. And if you see traditionally, there are some traditional families in which they used to insert yogurt in the vagina actually. So so it is just having the same lactobacilli, but maybe that is not the right way. But these days we have proper way of taking the right flora, which is the probiotics. So taking probiotics keeps the normal flora normal, basically, because the normal bacterial flora of the vagina keeps the pH right. And it can be important when the normal intercourse. So there are three ways any couple gets pregnant. One is intercourse, the second is intrauterine insemination, and the third is IVF. And if you see in all of that, um, especially in the first option, the flora is very important, because both early pregnancy and the way the pregnancy is conceived will be affected by the vaginal flora. So although the studies are not very massive, but there are tests based on that. So Emma and Alice are the tests which are created to test these, and then we know whether the normal flora is there or any other infection is there. But taking probiotics doesn't need too much data. So I think probiotics should be a part of general treatment anyway for fertility. Um, the evidence is gaining with time. So as the more studies are conducted, we don't have enough evidence yet to say anything conclusive, but we do have probiotics as our protocol in general to give to all patients, not just only to endometriosis. So we don't know the connections yet, how it affects, but then all subfertile patients might benefit from adding probiotics. Some chronic endometritis can also be present when, especially, we have the history of um, previous miscarriages. And in such patients, we do give antibiotics also, like doxycycline, to cover that. So both probiotics and with the use of doxycycline or metronidazole, this combination sometimes works in certain cases where the implantation issues are there, or where the early miscarriages are happening. So this is a part of the protocol for those patients definitely who have had previous miscarriages.